All right. Hello, Mr. Sparrow. My name is Hillary. I'm going to be your student nurse today. Could you please tell me your name and age?
Travis Sparrow, 29.
Travis appears, or is alert narrative times 3. He appears well nourished, sitting upright, no obvious physical deformities. He is attentive and smiling with good mood, and his speech was clear and understandable, and he appears well groomed. For the skin portion of this assessment, I'm just going to assess your skin just by looking at it. It is intact. There's no obvious deformities, abrasions, just a few scars and some dryness. Onto the head and face. The face appears symmetrical, and I'm going to feel and palpate your scalp now for any bumps or bruises, and there's no lesions noted. Clench your teeth for me, please. I'm going to feel for the masseter muscles. They're equal bilaterally. Is there any pain or tenderness when we do that? Good. Now, if you could please stick your tongue out. Good. And I'm going to feel your sinuses. If there's any pain or tenderness there. How about right here?
No.
Okay. And next, I'm going to inspect your eyes. The outward appearance, his eyebrows, eyelids, and lashes are all intact. There's no obvious physical deformities. I'm going to inspect your conjunctiva, and they are pink. There's no redness or drainage noted, and his eyes are blue. Next, I'm going to test your pupils, so if you could just look at my nose. I'm going to test for that they're constricting, and I'm going to look at the right eye now for accommodation, and it is accommodating. And now this eye, it is constricting, and the left eye is accommodating. Pupils are equal, round, and reactive to light and accommodate. Now for the 6 cardinal positions of gaze, I want you to follow my pen light without moving your head, follow it with your eyes. Now I am going to test your near vision. So I have a card here for you to read. If you could cover one eye and read this top line for me.
The ducks are blue.
Good. And cover the other eye and read this bottom line.
The cat is black and white.
Perfect. And now moving on to the ears. I'm going, just on inspection, the ears are equal bilaterally and normal without any obvious physical deformities. I'm just going to palpate the auricles and the tragus. Is there any pain or tenderness in your ears?
No.
Okay. Moving on to the nose, it appears midline and symmetrical. Can you please cover one nostril and breathe through the other? And now the other one. Any difficulty breathing through those? Good. So nares are patent bilaterally. Now moving on to the mouth and throat. I'm just going to inspect. Your mouth appears without any lesions or abrasions. Lips are a tad bit dry, but without redness. They are pink and normal in color. Could you open your mouth for me, please? Good. Inside the mouth, I'm noticing there's no redness, no lesions, and it appears that his teeth are all intact. Could you open again, please? And say ah? Good. The uvula is midline and symmetric, and rises and falls. Also, his tonsils are about a +2 grade. Moving down to the neck, we are inspecting for any physical deformities. There's none, no goiter or bumps or lumps, no jugular vein distension, which we wouldn't expect anyways. Onto range of motion of your neck. Could you please up and down, move your head up and down, and then right to left. Good. Any pain with that? Okay. I'm going to have you shrug your shoulders for me. Any pain with that? And then both shoulders are equal strength bilaterally. Now feeling for your lymph nodes. I want you to tell me if there's any pain. These are the preauricular the post-auricular, the occipital, posterior cervical chain, anterior cervical chain, the tonsillar, submental. Oh no, these are the submental. These are mandibular, submental, and supraclavicular. Moving on to the carotid pulse, I'm going to feel bilaterally. The pulse is felt on both sides, equal and strong. And next is the trachea. I'm going to feel that is midline, and any pain or tenderness when I feel it. Okay, now I want you to turn slightly to the right here so I can assess your back, your posterior chest. Upon inspection, it appears that there's no obvious physical deformities. I'm going to test for expansion. I want you to take a deep breath in and out, and expansion is normal. And tactile fremitus, I'm going to place my hand on your back. Whenever you feel my hand, I want you to say the word 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. And the vibrations feel the same. Now I'm going to percuss the lung fields. Assessing for any dullness or tympany. And it appears that the resonant, his lungs are resonating. Resonance is normal. Okay, now on to percussing the CVA. So I'm going to lightly tap on above your kidneys here. I want you to tell me if there's any pain, okay? Any pain with that? Good. I'm going to now listen, auscultate your breath sounds. So if you could please just take a breath every time you feel my stethoscope. Okay. Lung sounds are clear and equal bilaterally. Now onto the anterior chest. If you could turn and face me, please. On inspection of the chest, I notice there's no obvious physical deformities. He does have a little bit of pectus carinatum here, but no serious obvious physical deformities or abrasions or lesions. I'm going to listen to your breath sounds real quick on the front. So take a deep breath. Okay. Lungs are also clear to auscultation anteriorly. And onto the heart, I am going to ask you to stand or sit up tall, please. I want to inspect your precordium here, and it appears to be normal. Palpating the point of maximum impulse for the apical pulse at the fifth intercostal space mid-clavicular line, and I do feel a pulse there. I'm also going to palpate for any thrills or heaves. Now I'm going to listen to your heart sounds on the right side, starting at the right side, second intercostal space, left second intercostal space, third intercostal space, fourth intercostal space, and fifth mid-axillary. Good. No, I've noted that the S1 and S2 are heard, but no obvious murmurs or rubs or abnormal heart tones. Onto the upper extremities, just going to, upon inspection, I noticed just a few scars on his right upper extremity. There aren't any other physical deformities. Can I take a look at your hands, please? Just some dryness again on the hands. I'm going to feel for the radial pulses. And they are both strong, +2, equal bilaterally. And I'm going to feel for capillary refill. And they are refilling perfectly. And range of motion of your arms, if you could raise up your arms like this, all the way up, down to the side, and then down. Good. Any pain with that? All right, and moving on to your abdomen, could I have you lie down, please? It appears that his abdomen is flat and soft, non-tender. There's no distension that I can see, and any pain in your abdomen at all. I'm going to auscultate for vowel sounds, starting in the right lower quadrant. Good. And I heard vowel sounds in all 4 quadrants. Next, I'm going to just percuss. Feeling for, again, for any dullness. Any pain with that?
No.
Okay. Now I'm going to palpate each quadrant lightly. Any pain or tenderness?
No.
Okay. And for the deep palpation, any pain or tenderness?
No.
Okay. And I forgot, I'm going to listen for any aortic bruits. Moving down to the lower extremities, I'm inspecting his legs. They don't appear to have any obvious physical deformities. Hair distribution is equal, just a few scars and scratches, nothing out of the ordinary. I'm going to take your socks off here so I can feel your dorsalis pedis pulses. And the posterior tibialis pulses. Perfect, they are equal bilaterally. And now for range of motion of the leg, I'm going to ask you to lift this leg up and bend at the knee. We're going to do abduction and adduction. Good. And now this leg, abduction and adduction. Any pain or bend? Okay. Now you can sit up. I'm going to move on to the neurological part of the assessment. Got my cotton ball here. So I'm going to touch you with this cotton ball. I'm going to ask you to close your eyes. I just want you to tell me where you're feeling the ball, okay?
My left cheek.
Good.
My right cheek. My left arm. My right arm.
Perfect. All right, moving on to cerebellar function. I'm going to ask you to put your hands out like this and move them back and forth. This is pronation or supination and pronation, and it appears intact. And if you could move your heel, take your heel and move it down your shin. Perfect. And on the other side. Starting up, yep. Perfect. Cerebellar function is intact. Now for the reflexes, I have don't have my reflex hammer, but I have this awesome reindeer pen that will act as my reflex hammer. So I'm going to have you relax your hand just like this. And testing for any reflexes there. Beautiful. And have you put your hand just like that and just relax your fingers. Good. And patellar reflexes. Normally we'd have you swinging your legs, dangling and relaxed, and I'd be testing for the leg to move out, which they do. And the Achilles reflexes, also feet relaxed and assessing for either no movement or a little bit of a, oh, and also the, what is it called, patellar, or plantar, sorry, plantar reflex. I'm going to kind of tickle the bottom of your foot and it'll also react. Perfect. All right, and for the last part of our assessment, I'm going to assess your musculoskeletal. So if you could stand up and just take a few steps forward. Good job. And turn around and come back toward me, doing a heel to toe walk. Good job. Now for the Romberg test, I want you to stand with your arms out, eyes closed, and bring one leg up and balance on the one foot. Good, he's equally balanced. And for a range of motion of your back and spine, I want you to lean forward and backward. Good, and side to side, and twist. Perfect. Thank you very much, Mr. Sparrow. I appreciate you being my patient, and I hope you have a great day.